risk of developing numerous chronic health conditions. One of the strongest associations exists between obesity and type 2 diabetes due to insulin resistance. Excess body fat can impair the body's ability to regulate glucose effectively, increasing diabetes risk. Obesity also contributes to cardiovascular disease with elevated blood pressure, increased cortisol levels, and similarly elevated. Research has further linked obesity to several cancer, including breast and endometrial cancers. These health complications can contribute to increased mortality rates and reduced life expectancy. Understanding these physical consequences highlights the importance of prevention and early intervention. In addition to physical health consequences, obesity can significantly affect mental health and psychological well-being. Individuals with obesity may experience depression, anxiety, and lower self-esteem, particularly when exposed to weight-related stigma or discrimination. Negative body image and dissatisfaction with appearance are common and can contribute to social withdrawal. Psychological distress may also interfere with motivation to engage in healthy behaviors such as exercise and dietary modification. Health psychologists recognize that addressing emotional and psychological concerns is often necessary for successful long-term management. Effective obesity treatment, therefore, requires attention to both physical and mental health outcomes. The three-factor eating questionnaire, commonly referred to as the TFE, is one of the most widely used instruments in obesity research and clinical practice. The questionnaire assesses refers to deliberate efforts to control food intake. Uncontrolled eating reflects difficulty regulating food consumption and susceptibility to overeating. Emotional eating measures the tendency to eat in response to emotional states such as sadness, stress, or anxiety. The TFEQ provides valuable insight to behavioral patterns that may contribute to obesity and help clinicians identify specific areas requiring intervention. The TFEQ has numerous applications in both clinical and research settings. Physicians use assessment results to identify behavioral patterns that contribute to obesity. For example, high emotional eating scores may indicate the need for stress management intervention or cognitive behavioral therapy. Researchers frequently use the instrument to evaluate treatment effectiveness and understand factors associated with weight gain and weight loss success. Because the TFEQ can be administered repeatedly over time, it is useful for monitoring progress and evaluating behavioral changes throughout treatment. Assessment data ultimately guides evidence-based interventions and improve patient outcomes. Lifestyle modification remains the first-line treatment recommendation for obesity. These interventions focus on improving dietary habits, increasing physical activity, and developing sustainable health behaviors. Self-monitoring techniques such as food journals and activity tracking can improve awareness of behavioral patterns and support accountability. Goal setting helps individuals create realistic, measurable objectives. Although short-term weight loss can be achieved through lifestyle changes, maintaining weight loss requires consistent effort and long-term adherence. Health psychologists play an important role in helping individuals overcome barriers and maintain motivation throughout the behavior change process. Cognitive behavioral therapy is one of the most effective psychological interventions used in obesity treatment. CBT helps individuals identify and modify thoughts, beliefs, and behaviors that contribute to unhealthy eating patterns. Patients learn healthier coping strategies for managing stress, negative emotions, and cravings. CBT also focuses on improving self-regulation and problem-solving skills. Relapse prevention techniques help individuals prepare for challenges that may threaten long-term success. Research demonstrates that CBT can significantly improve weight management and outcomes when combined with dietary and physical activity interventions. For some individuals, lifestyle interventions alone may not be enough to help weight loss. Medical treatments can provide additional support. Anti-obesity medications can help regulate appetite, reduce food intake, or alter metabolic processes. Recently, GLP-1 receptors agonists have gained significant attention because of their effectiveness in promoting weight loss. Bariatric surgery remains one of the most effective treatments for severe obesity and can result in substantial long-term reduction. However, successful outcome depends on ongoing behavioral changes and multidisciplinary support involving physicians, psychologists, dietitians, and other healthcare professionals. Current obesity research consistently illustrates that multi-component interventions produce the best outcomes. Combining dietary modification, physical activity, behavioral counseling, and medical treatment when appropriate addresses multiple contributors to obesity simultaneously. Long-term support is essential because obesity is a chronic condition characterized by frequent relapse. Emerging research is exploring personalized treatment approaches based on genetics, behavioral profiles, and individual risk factors. Public health efforts focusing on prevention, environmental change, and improved access to healthy resources remain important priorities for reducing obesity prevalence worldwide. In conclusion, obesity is best understood through the biopsychosocial model. Biological factors such as genetic and hormones interact with the psychological influences including stress, emotional eating, and self-regulation. Social and environmental conditions further shape risk and treatment outcomes. Assessment tools such as the TFEQ help clinicians identify important behavioral patterns and guide intervention planning. Evidence-based treatment approaches that integrate lifestyle modification, psychological intervention, and medical care provide greatest opportunity for long-term success.
Keep on going. Every time I try to tell them to stop, they keep on touching something down.
Develop more effective preventative and treatment strategies.